Okay, external anatomy of the heart. These are the auricles. Okay, looking at the anterior view, this is the right side. The apex always goes to the left. Your pulmonary trunk's going to always be the most anterior vessel. So that makes this auricle the right. That makes this ear leg flap the left auricle. The atria are the chambers behind the auricles. So this would be your right atrium. This would be your left atrium. Where these two artery and vein blood vessels go down on the heart, they sit within a small groove or sulcus called the anterior interventricular groove or sulcus. That marks where the wall separating the ventricles is inside the heart. So if you kind of do imaginary line, everything on the left side of my hand, this is the right ventricle. Everything on the right side of my hand would represent the left ventricle. Blood vessels, the great vessels you can see, they all come up of this bigger part of the heart, which is called the base. Okay, so extending from the base, you have the pulmonary trunk. The pulmonary trunk will split off into your left pulmonary arteries. And from the back side, actually I'm not showing it, this would branch off into right pulmonary arteries. Okay, then it goes the pulmonary circuit, pulmonary capillaries, gas exchange, and then it brings fresh oxygenated blood back to the heart through, this would be your left pulmonary arteries. And if I show it from the back, this would be the right pulmonary arteries that are bringing fresh oxygenated blood from the right lung. So all the oxygenated blood gets sent to the left atrium, and then it'll go through the left ventricle, and then it's going to enter the aorta. This portion is the ascending aorta, the aortic arch, and then this that goes behind the heart, this is your descending aorta that's going to continue to go down through your ventral body cavity. Internal anatomy. Okay, on the right atrium, you have this red area. That is the opening of the coronary sinus, which is bringing the deoxygenated waste-filled blood from the heart itself. Also entering this chamber, you have the waste-filled blood from the superior vena cava and from the inferior vena cava, which is just showing the opening of it. Okay, so blood then from the right atrium will pass through the white structure, which represents your right atrioventricular valve or tricuspid valve. Attached to the valve, you have the chordae tendineae, the strings that would be attached to that small A. That's a finger-like muscle, which we call papillary muscle. Okay, and the ventricles, you also have this textured muscle, which probably looks better right there. So the textured is called trabeculae carnae, where C, the part that extends up, that is papillary. Okay.